Good morning, good afternoon, good evening. My name is Javier Guzman. I'm Director of Global Health at the Center for Global Development, and it is a pleasure to welcome you to this event about universal health coverage, a new initiative called the New Health Impact Investment Platform, and of course, primary health care. So it's great to have you with us. We'll have a 1-hour conversation. But the first thing I want to say is, primary health care is widely recognized as a key component of, a high-performing health system. Of course, it's essential. It's a foundation of universal health care. People talk about pandemic preparedness as well and primary health care. And WHO has said that 90% of essential health services can be delivered through primary health care. So we see how important it is. We've had data on how it reduces hospitalization, how it reduces the use of emergency services, how it reduces mortality and actually increases life expectancy. There is some data that basically says that if countries invest for 10 years on primary health care, average life expectancy could increase by 3.7 years by 2030, and 60 million lives could be saved. So we know this, and we've known this for a very long time. You all know, you all have, heard about the Alma Ata Declaration in 1978, when primary health care was seen as a global health priority, and countries committed to primary health care. However, the reality is different. And unfortunately, the investments, the financing of primary healthcare is very low. It's estimated that about $3 per capita are spent in low-income countries on primary healthcare, and $16 in lower middle-income countries. That is very, very small compared to the around $60 that is the recommended expenditure in those low and lower middle income countries. So we want to talk about financing because we think financing is key to actually move the needle in relation to primary health care. We know that countries need to invest better and we need to invest more, and we're very excited because we heard in June 2023 how the World Health Organization, with 3 development banks, the African Development Bank, the European Investment Bank, and the Islamic Development Bank, launched this new health impact investment platform to strengthen primary health care. And they committed $1.5 billion, which is a great way to get us started. Of course, that is not very big if you compare to the need. WHO estimates that between 200 and 370 billion a year are needed to really scale up primary health care. And they recommend that governments will invest an additional 1% of their GDP on primary health care. So we're far, but we're excited about this new development. So today I've got a stellar panel that have joined me to discuss the initiative, but also to talk a bit about primary healthcare in general. So we've got 4 distinguished guests. The first one is Babatunde Omilola. He is the head of the Public Health Security and Human Development Division at the African Development Bank Group. So thank you very much, Babatunde. We also have Marianne Etiebet. She is the Associate Vice President of Health Equity at Merck, and she is the lead of Merck for Mothers. And clearly, she's also a CDD board member. We've got Cornel Ntihabose. He is the head of clinical and public health services at the Ministry of Health in Rwanda. And last but not least, we've got Pablo Ibararan, who is the Social Protection and Health Division Chief at the Inter-American Development Bank. So we've got a stellar panel. Thank you very much for joining. Thank you very much for being with us. And the first question is really a general question that we want to, hear from you all about your overall reflections on this initiative, the Health Impact Investment Platform. Do you think that, 1, is a step in the right direction, and 2, it will solve the problem with financing of primary health care? Babatunde, over to you, and thank you very much for joining us.
Thank you very much. I'm very delighted to join you from the African Development Bank. Let me answer your question straightforward and say that, yes, this is a step in the right direction. The Health Impact Investment Platform is extremely needed for low and lower middle income countries in today's world, especially after the COVID-19 pandemic experience that we have seen around the world. So we are very delighted that our president, the president of the African Development Bank, the president of the Islamic Development Bank, the president of the Inter-American Development Bank, the president of the European Investment Bank, as well as the Director General of WHO, decided to sign this platform into action in June in Paris. So for us, I think this is really needed, especially when you look at the needs. We need a lot of additional funding in the health sector, particularly for primary healthcare facilities, in order to strengthen health systems, but also to ensure government accountability and ensure that we support all those elements of primary healthcare facilities that are not working in many of our countries. You would notice that in our own analysis at the African Development Bank, we have seen that the financing gap is extremely huge when it comes to health infrastructure in Africa. What we have seen is that what is needed to ramp up health infrastructure in Africa is $26 billion every year. And what is currently being spent for healthcare infrastructure in Africa is around $4.5 billion annually. So we have a gap of about $21.5 billion for health infrastructure in Africa. And so this is a good step in the right direction because this platform aligns with the strategies of all the principal multilateral development banks that are participating in this platform. Because for us at the African Development Bank, for instance, we have our first strategy in the health sector, which we call the Strategy for Quality Health Infrastructure in Africa. This was a strategy that was approved by our board just last year in February 2022 because of the call by the governors of the bank that the bank must articulate its role in healthcare delivery for Africa. And so within our strategy, let me mention that we have three quick pillars. One is the primary healthcare infrastructure, which is the fundamental, which is the first. And then second is the secondary and tertiary healthcare infrastructure. And then third is what we call diagnostics. And at the same time, we are supporting digital health infrastructure, innovations in health service delivery, and we are supporting harmonization of health standards in Africa. So this platform is really a very welcome one. And I can tell you that we have had the inaugural meeting of the technical teams of these institutions. We had a meeting in Geneva just 2 weeks ago for us to begin to unpack how to operationalize the platform, how to do country prioritization, but also how to do partnership agreements across our different institutions. And so this is a right step in the right direction. Thank you.
Thank you very much, Babatunde. Cornel, what are your thoughts about this initiative, and how do you see it from at the country level from Rwanda? Rwanda was included as a very interesting example of how different funders and banks could collaborate. So, what are your thoughts on this initial question?
Thank you, Javier, for inviting us as Minister of Health in Rwanda, and we really thank WHO and other development banks to join efforts and put in place this opportunity. We think in Rwanda that is a good initiative for two reasons. The first reason is the global community is very slow to implement and also achieve universal health coverage. Two, to accelerate and push for primary healthcare targets, we need more resources. We need financing in terms of money, so that we can invest in various building blocks of the health system. Allow me to start with the slowness in implementation of those activities that can put in place and also can avail services closer to the community. If you look at the service coverage and you compare 2000 and 2015, the progress the global community has done, and if you compare to the era of SDG, there is very slow progress. According to WHO Service Coverage Index, there is the coverage index increased from 45 in 2000 to 69 in 2019. And between 19 and 2021, there's no progress at all in that service coverage index. But surprisingly, because most countries like ours, Rwanda, and other middle income countries had high burden of infectious diseases, malaria, TB, HIV, and other infectious diseases. For a period between 2000 and 2015, the infectious diseases sub-index improved the fastest with an acceleration which started around 2005 with the introduction of HIV treatment and other the tools to combat malaria and TB. Reproductive, maternal, newborn, and child health also sub-index has improved. But on the other hand, NCD and service capacity and access sub-indexes experienced some slower gains even between 2000 and 2015. And this progress between 2000 and 2015, which was very good, but very slow between 15 up to now, caused maybe other reforms, other way of thinking. And if you look at the era of SDG, there's some important gaps that are persisting in people's ability to attain the highest possible level of health. And it is estimated that half of the world's population are lacking access to the services. And as you said in introduction, PHC interventions, if you want to scale up across low and middle income countries, you could save 60 million lives and increase life expectancy by 3.7 by 2030. And it is estimated that in 2021, 2 years ago, about 4 billion of people were not full covered by essential health services. This is a gap to achieve, and it really needs and attracts some attention and also cause for any reform. And during COVID has disrupted many essential health services. Most countries reported disruptions in 2012 to 2021, and also even last year, some disruptions were still reported. And in particular, in African countries, it is estimated that 48% are not accessing to the healthcare they need. And if we need to reform and to need more resources and to inject so that we can bring closer to the community the health services, we need 400 billion a year for a more comprehensive package of health services. In particular, in Rwanda, with a new leadership within the ministry, we have started some reforms. I may mention some. We have one reform on strategic purchasing of equipment, because our survey are indicating that some health centers, health posts, and even some hospitals are lacking some key equipment. So we are thinking, how can we strategically purchase the equipment? We're working with those manufacturers so that we can receive a big bunch of equipment at right price, and also with proper maintenance. And also we are reforming our primary health care, including the community health workers and also the health posts and health centers, because the target is that 90 or 95% of the essential health services could be provided within community health workers, within health centers, and within the health posts. We are reforming, and really, our community health workers have supported over some years ago, but we need a reform, because it's no longer malaria, which is a burden. It's no longer HIV, which is a burden, but it's still there. But we are seeing our population dying with NCD. How can we decentralize up to the community? The screening, also bringing some tools like medication, and also the other reform, which is very heavy, which is need more resources. In the ministry, we call it 4x4. If you look at the minimum workforce across all countries in Africa, only 3 or 4 are meeting WHO minimum workforce needed. 4 3.4 workforce per 1,000 population, and in Rwanda it is 1.1. We have a slogan of quadruple the production of workforce and retain them within our facility. So we are trying to enroll more students within medical schools in various programs, nursing, midwives, and medical students and other allied health professionals. So we need more resources to inject within this program. We have started since June. If you look at how we started at this pace, we could multiply 2 times, but we need to multiply again 4 times to achieve our vision, so that we can have enough workforce, enough equipment, strengthen health system, so that the needs of the population could be met. So in summary, I could say this financing model comes in the right time, particularly in Rwanda, but on an African perspective, and also in perspective of middle-income countries that are needing more resources to inject in their system. Thank you, over.
Thank you very much, Cornel, and thank you for reminding us, one, that progress against the SDGs have been extremely slow, and two, your last point about the importance of human resources, community health workers, and your 4x4 initiative, and the triple burden of disease. So with that, Marianne, I just wanted to, shift gears a bit and hear from you. I mean, you come from a very different perspective. What are your initial thoughts? Thanks for being with us.
Thank you, Javier. As you mentioned, I'm bringing some of the private sector perspective to the discussion, as well as the years of work that we have done collaborating across sectors through the Merck for Mothers program, which is also known as MSD for Mothers outside of the USA and Canada. So to your first question, yes. This is definitely us going in the right direction. And as Cornel mentioned, it couldn't have come a moment too soon. The world, I do think, is ready, for this type of platform. And I'd like to commend the banks, as well as the Director General of the WHO, for their vision and for their collaboration in pulling this together. The vision comes first, but ideas do need financing to actually get started. And it was great to hear actually from Babatunde as well that the action has started. And so I think with that intentional approach in how they are thinking about focus on quality, which is really important. We know that 60% of the deaths are actually due to poor quality where access is available. Thinking through how do we put innovations, into this platform. I'd love to hear more, as Cornel mentioned, around human resources for health being a critical part of health systems. I think this is a huge opportunity to invest in the people that are actually driving health and the delivery of healthcare in systems. So we're really excited about this. One of the things I'm particularly excited about is how it can enable us to actually not just take care of the infectious disease burden, I think as Cornel was mentioning, but start to think about NCDs and how do we create a very strong foundation for the awareness and education, the prevention, the screening, the diagnosis, the care and treatment, and the support for the non-communicable diseases. We know that this is a tsunami waiting to happen. It's actually already affecting so many populations and communities in low and middle income countries. And I would say that as a global health community, we have yet, I believe, to seriously think through how we are going to address this burden that is already with us and how we are going to finance it. And I think this focus on primary healthcare and investing in primary healthcare platforms is exactly the way to go. Primary healthcare is the first mile. It's not the last mile. One thing I'd like to also add, I started my work in global health in the HIV/AIDS sector as an HIV physician, working now, with on maternal health issues. thinking through how do we move from a vertical programming, type mindset when we think about global health challenges to more of a horizontal health system strengthening mindset. And I do think this primary healthcare platform will allow us not just to frame the opportunity from that perspective, but also to invest in that perspective. I want to share one analogy I sometimes use, to talk about how we do global health right now. It's almost like a game of Twister, where all of these vertical programs are trying to figure out how to connect to each other and how to connect to people on ground. And eventually we fall down because it's just too heavy a burden and we're not able to twist ourselves in all the different ways we need to actually leverage all of our resources together and work in a streamlined and efficient way to meet the multiple and evolving healthcare needs of people. And so with this primary healthcare platform and the foundation that it creates, I do think that we will perhaps identify current inefficiencies through this focus on vertical programming and actually unlock even more financing to address this huge gap that the other panelists have mentioned.
Thank you very much. I really liked your analogy. My kids would, I now know how to explain all these vertical programs to my kids. Pablo, what are your views? You come from a development bank yourself, so is this a step in the right direction? And we saw, your president being part of this high-level announcement in June. So what are your thoughts?
Yes, thank you very much, Javier, for the invitation, and happy to share this virtual meeting with these distinguished panelists. And I think this is, yes, a very important topic. I think the platform is calling for greater and more efficient, effective investment in primary healthcare. And as you mentioned in the introduction, this is not new. There's a broad agreement on the importance of primary healthcare, not only of the primary care level, but the health, the overall approach, right? With integrated networks and with a very strong primary healthcare as the door where people should enter the health system. And as you mentioned, 90% of services, 80% of the issues should be resolved at that level. And there's also evidence that this is the best way to deal with the challenges, as Marianne was mentioning, of NCDs, of mental health. So this is the platform where we can hope to really deliver care and improve the health of citizens in the world. And I agree also that there is an interesting transition from the vertical programs that strengthen some capacities, and then the challenge is how to broaden them. So this is certainly a very, very important, the contents of the initiative is very important. And also we know that government spending is low in health in the region. In Latin America, the region where I work, it's below 5%, when below the target set by the Pan American Health Organization, who's the regional office of the WHO in the region, and it's the lead technical, let's say, advisor of governments for all health issues. And also the annual number of doctor consultations in the region, for example, is 3.5, almost half than what happens in the OECD countries. And the OECD report on health at a glance shows, for example, that there is a close relationship between doctor consultation rates, that's a proxy for access to services, health spending per capita, and health results at the end of the day. So given that we know that primary healthcare should be the cornerstone of health systems, also, I was just in meetings about pandemic preparedness. A strong primary care level is basic. It's cornerstone for having surveillance and for the first response, and also the laboratories that are part of the network. So this is certainly something that we need to invest more. So I think this platform that advocates, and this is very important, to a country-led approach, one country, one plan. So this is something that's very appealing for us, because the needs in health are much larger than what any institution can deliver by itself and what governments can mobilize from domestic resources. So this idea of having one plan that has the leadership in Latin America of PAHO and the other actors working in health, very much led by the country, will allow us to really put our resources and mobilize investments in the key and the most important areas. I was going to quote, but also Marianne mentioned the issue that quality is of other importance. And I want to emphasize that it's not only expanding coverage. 70% of deaths occur because of quality issues, not because of access. So then this is very important for us to preventable deaths occur. So this is very important that when this platform will mobilize resources to invest in primary care with a focus in quality. And I think we can continue talking a little bit more later on how this will happen. Will this significantly contribute to solving the financial aspects? I hope so. I think putting this in the agenda, putting the efforts, as my colleague from the African Development Bank mentioned, there have been meetings and there will continue to be opportunities to work out the details. But the important thing is to be sitting in the table and to be putting the attention on this aspect. We've seen this week how many events in the world are distracting attention from health, and health is really very important that we keep it on the table, that we keep discussing the issues, because it is the first step to having really healthy, happy lives for citizens. That it is what eventually we all want to achieve. Thank you.
Thank you very much, Pablo. Thanks for reminding us of the importance of, high-level leadership and really having this primary healthcare topic at the top of the political agenda. So this could actually be a very good starting point to maximize the benefits of this initiative. We are all excited. I think we all agree that it is a step in the right direction. I think, and I don't know if my other panelists are thinking the same, but we're wondering the how. We're wondering, more details about how will this work. And of course, importantly, how do we make sure that there is value for money? How do we make sure that the money that is invested into this initiative really gives us the biggest bang for the buck? So on that note, Babatunde, can you tell us a bit about that? What are your views about ensuring value for money and deciding on what to fund and what not to fund? You mentioned infrastructure. Cornette talked about human resources. We've all talked about NCDs. I think the needs are huge, but how is it that this platform is going to work? Over to you, Babatunde.
Thank you so much again, Javier. I think as I started earlier on, the conversations on how the platform will work, country prioritization, the scope, the processes through which the platform will be operationalized. We have started those conversations. We started 2 weeks ago in Geneva, Switzerland, and I represented the African Development Bank at that meeting. Of course, while discussing the how, one of the things that we have seen is that we are not starting from the scratch. All these multilateral development banks, we have our plans, we have our strategies that are focusing on health and focusing on how to strengthen health systems in all the countries where we operate. At the same time, we are focusing on what do we need to do with primary health care facilities themselves? How do we connect them to basic amenities that are needed? From our own analysis at the African Development Bank, we have seen that Africa has the largest density when it comes to primary health care facilities. But many of them are not connected to water, to sanitation, to transport, to ICT, to all the other things that are needed, including electricity and energy, to run efficient primary health care facilities. So our will be to ensure that we help to revamp, revitalize, and ensure that a lot of primary health care facilities that are there in low and lower and middle income countries that are not functioning well become much more functional, and they are able to provide essential health services to people that need them, especially as we drive towards universal health coverage, so that we deal with financial protection as well. Now, in terms of the areas that we are thinking that these platforms should focus on. One of the areas is to help us answer some of the questions related to environment, climate change, health linkages in many of our countries, especially low-income countries, but also low and middle-income countries. The other area is to look into supporting medical schools that will be focusing on primary healthcare facilities. And that way, we will not only be dealing with ramping up health infrastructure, but we will also be dealing with supporting vital health workforce development that will be needed in many of these countries. Again, it would also be important to link this to nutrition so as to be able to address the issue of malnutrition. For instance, in Africa, malnutrition is costing our economies about $25 billion every year. And so we need to address malnutrition as part of ramping up support for these primary healthcare facilities. Now, having talked about the scope, the key issue is that all countries are eligible, of course, in low and lower middle-income countries, but then there will be country prioritization based on the availability of health strategies and plans in countries, but also based on the readiness of these countries. One important element in all of these is that we have discovered that ministers of health and ministers of finance and economy and national planning in many countries, they don't tend to interact as much. So one of the things the platforms will do is to help build the business cases on a case-by-case basis for different countries in a way that we can help ministers of health to strengthen their arguments with the ministers of finance and economy and bring these two key ministers together so that we can have a way that more domestic resources can also be channeled towards primary healthcare facilities, and then allow value for money, which also is very important. Around value for money, one of the things that we have discussed is how to strengthen and build capacities of these countries to be able to deal with spending and allocative efficiencies in terms of health financing in many of these countries. And already we have some tools to do that. For us in Africa, at the African Development Bank, 2 years ago, we prepared a tool, a guide called Value for Money Guide in the health sector, which is extremely useful and which countries are using to efficiency, allocative efficiency, but also to be able to deal with the absorptive capacity and deal with wastage in terms of resources in the health sector. We have also developed a tool at the African Development Bank, which we call the Public-Private Collaboration Tool for universal health coverage in Africa. With all of these tools, all of these knowledge products are on our website. And we did all of this under the umbrella of the Harmonization for Health in Africa in close collaboration with the World Health Organization, WHO Regional Office for Africa. So the idea is that many of these tools will be used as guides to support countries in terms of ensuring value for money, but then also to crowd in the private sector into the space, especially in the longer term, because the resources that are needed, the investments that are needed are huge. And what we currently have and what we are dealing with is still just a drop in the ocean. And so we need to bring in more partners. And so all of these are part of how to make this work. And finally, we are now working on the necessary documentation in terms of partnership agreements that should be there among the partners and how the roles and responsibilities will work. We are planning to have a steering committee, a technical committee, and also a secretariat. And WHO will act as the secretariat in order to make this all work, especially because of his presence all over the world. So those are some of the details that are coming, but I think in the next weeks and months, we will see more well-refined details in terms of the operationalization of the health impact investment platform. Thank you very much.
Thank you very much, Babatunde, for giving us that update. We'll be watching and following carefully. Cornel, Babatunde talked about, strategies at the regional level. We've also mentioned, investment plans at the country level. From your perspective, how do you ensure value for money, or what do you think about the best, way to use these resources? Over to you, Cornel.
Thank you, Javier. The driving force of value for money is accountability, and in Rwanda we are used for accountability. Normally, all projects and also all ministries are audited by Auditor General, and sometimes they don't audit not only finance, also they audit the performance of the project. If the project has achieved a certain goal that was set during the project elaboration and also during plan. So accountability and if ensure that sometimes the funders are mobilizing the resources from their donors. Sometimes also bilateral, they get the money from their taxpayers. So they owe the accountability and explanations to their taxpayers. If it is banks, they owe their explanations to their boards. If they are invested in some certain countries and what they have invested has achieved anything which is tangible on ground. And also when we submit a project, for example, to African Development Bank, to any bilateral and other bilateral organization, we have clear goals and clear plan where we want to go, and during implementation we ensure that we achieve those goals, and we set up mechanisms, and Rwanda has chosen to establish what we call a single implementation unit. Before, it was very difficult managing some projects. So every ministry, every major agency of the government has an office dedicated to implementation of the project. And we bring in some experts who are conversant with projects implementation so that you follow the various steps within the proposals and also agreements you have with any funder. But bearing in mind that at a certain stage, the Auditor General will come in and they audit the finance if you have really used well the money, but also any performance evaluation audit must be conducted to see if really the results are on ground, and sometimes they ask population and also they go on field and see if it is infrastructure, really is it there, if it is a workforce trend, if it is maybe malnutrition reduction, how far are you, what's the baseline, how far are you, and they elaborate a performance report and benchmarking to what you agreed with a funder, and submit both to you and the end funder the report. Thank you.
Okay, well, importance of accountability, importance of implementation and streamlining implementation, and finally something that we at CGD strongly believe in, which is evaluation. Evaluation as a way to, have a virtuous cycle and feedback on the design and the way the future money will be spent. Marianne, what are your thoughts about, what would you advise or what would you say about the best way to maximize the value for money, the best way to get the biggest bang for the buck in this platform? Over to you.
No, thank you, Javier, for the question. I think for all of us, it really is, as Babatunde said, being intentional and also not just looking at what the data tells us, but looking backwards to our past experiences and making sure we are learning from the combined knowledge and experience of this. This is not the first time we've tried to do primary health care. And so we should definitely make sure that we are looking back to lessons learned and what's worked well. For one example, again, love to commend the Ministry of Health in Rwanda. They have experience in investing in primary health care, in investing in prevention for vaccine preventable cancers. Let's look and see, what the impact of that on future budgetary projections. And it sounds like from what the Honorable Minister has said, that how they are now reallocating those saved monies, for further investments in foundations in primary healthcare and in people. So I think my first point is there's so much learnings across the global health community. We should make sure that they are platforms to integrate them as we build and design for a stronger healthcare system. The second point I want to make relates to some of the exciting things that I heard Babatunde mention, which was around how can we be intentional about these new investments actually doing double, triple, quadruple duty. He talked about climate proofing, climate mitigation. So how can we actually make investments in infrastructure that are actually helping to climate proof for the future? Because we do know, if we're thinking about this from an equity perspective, that the impacts of climate will be felt hardest by the most vulnerable populations that are already bearing the brunt of poor outcomes globally. The other thing that he mentioned that was really exciting was thinking about the broader social determinants of health and how this has to not just sit in the health sector. Besides the collaboration with the ministers of finance, I do think when we look back, we do know that 80% of health outcomes are actually not driven by things that happen in the health sector. They're driven by the social determinants of health, transport, housing, electricity, etc. And so this is really an opportunity to actually invest in that 80% that we know drive health outcomes globally. So I was also really excited to hear that. One more thing I'd love to see, as we design this platform, or we design the investments that this platform is going to help accelerate, is making sure that we are also integrating gender equity considerations in who we invest in, how we invest, and thinking about the gender impacts of the investments in the primary healthcare system. We do know that 70% of healthcare workers are female, yet as you think about those who are making decisions and those who are leading programs or institutions or organizations, that percent dramatically reduces the further up you go from a leadership perspective. So that's something I would love to see in investment plans. Then the third point I want to make is back to your question around value for money. We know that all of this money needs to work harder, it needs to work smarter. What I would like to bring to the table is how we think, again, as a community, of bringing private sector to the table and thinking about private sector contributions, not just as financial and financing contributions, but what else can we leverage and capture from the private sector to create that value? So one, maybe financing, but two, thinking about innovations, that are created and created in private sector, and how do we make sure that those innovations get integrated into these plans, integrated into how we are investing and how we are doing service delivery in primary healthcare settings. And then the other thing I would say for low and middle income countries is that in many countries, even over 50% of healthcare services are delivered by the local private providers and local private sectors. How are we making sure that we are actually capturing those contributions that are already existing on ground as we think about these plans? One of the things that for example, Work for Mothers, has done and has experienced, and again, happy to share all of this as the community is thinking through the design of these investments, is our work with, for example, the WHO Private Sector Country Connector, where we know we don't just need the very high-level policy in order to create enabling environments, but we also need to pay attention to the micro policies and practices and processes that can often undo the best intentions. And so really creating those platforms for folks, not just at the national level, but sub-national level, to kind of get into the weeds of how to actually make this work and how to make the integration work.
Thank you, Marianne. You highlighted the importance of learning or the priorities, social determinants of health, the gender, private sector, all very important and interesting points. Before I get to Pablo, I just wanted to remind our audience that they could submit their questions using Twitter at CGDev, using the hashtag CGDev talks, or can email us at events@cgdev.org, or include your comments in the YouTube chat window. So Pablo, you mentioned something very interesting, which is one country, one plan, and the importance of leveraging resources. So can you talk a bit about that value for money question and, getting the biggest bang for the buck in the context of that one country, one plan proposition? Over to you, Pablo.
Thank you, Javier. Yes, I think something that's important to take into account is that in Latin America, we have very little access to concessional finance. So this platform, I think, will provide an opportunity to leverage that and to get some concessionality that we know can be catalytic in mobilizing resources. And therefore, we need to have these two aspects that you mentioned. First, a very clear and strategic plan, country-led, where we can see where we can put these new investments. And I think concessionality tied to domestic mobilization of resources can be a key here. And second, we always need to act with a very clear idea of efficiency. And this is what value for money is all about, right? So even we know, and you were here at the bank last week, that we have an event on smart spending on health. And there are many aspects in primary care where we need to be certain that we are applying these resources in the more efficient way. Babatunde mentioned that one aspect that was being developed or was discussed in the meetings in Geneva a couple of weeks ago were about the importance of human resources. And this comes also to what Marianne was talking about, the gender perspective in the human resources workforce in health. And I believe that we need to be, this is a good example because we need to be very intentional in saying, we need to develop more human resources, but we also need to use them in the most efficient way, in the sense that we need to have community health workers, nurses, and then doctors being able to perform the necessary tasks to provide health to the population, because community provision is at the basis of primary care. And this is a way that perhaps is not evident, but it is a very important step in order to achieve value for money. Also, we need to think in a very broad way, and I'm very happy that discussions were also turning around climate resilient health systems, because a strong primary care system is necessary to really provide the resilience that we need in the face of climate change. I'm talking about laboratories. I'm talking about emergency systems, ambulances. All of this needs to be integrated and really work as a strategic, let's say, institution in order to provide these services. So that's also value for money. So the something that's very, very appealing about this global platform is that we will be able to have knowledge and learning from across the world and be able to really learn from successful initiatives. For example, also building the investment case. That's key for this discussion that we were having at the bank here last week about the necessary conversations between ministries of health, ministries of finance. We need to be certain that these conversations take place, but that we have the inputs to have a meaningful conversation and exchanges ideas. So I do believe that value for money at the end of the day is critical, because any resource that we're able to mobilize, additional resources that we're able to mobilize, will only provide health and improve lives if we are using them in the most efficient way. So I think there are many pieces that are coming together in this discussion. I'm very excited about the perspectives of this, and to keep the momentum going, and hopefully being able to provide some examples soon about how this platform will be delivering financing and technical work to improve lives of the people. Thank you.
Thank you very much, Pablo. You talked about something very important. We want results very soon, and of course, results will only increase, traction and will clearly help us get attention. So I'm just gonna get into a few questions from the audience. Babatunde, you've got a question here. People are very interested about what you said, and they want to hear about the timeline. Like, can you share some details on when you think the expert committee will be put in place, when you think there will be more information about the way the platform will operate? Over to you.
Thank you very much. As I said earlier on, a lot of these details are still being worked out. But the first things first, the vision is there. The communique has been issued by our presidents and the Director General of World Health Organization. The inaugural meeting has taken place of the technical teams of these different institutions to basically unpack the platform and to look at the scope and the processes. Now, in terms of the timeline, of course, we have also discussed some of the elements of the timeline. But before things can move forward very rapidly, there must be setting up a steering committee, the steering committee that will provide the governance for the platform. And then there will be the technical committee, which will involve the MDB, the multilateral development banks, as well as WHO. And then there will be the secretariat, of course, which is WHO. Now, in addition to that, we started around the country prioritization. So we have already indicated some countries in low and lower middle income countries where we can begin to engage directly at the country level with the key actors and stakeholders in those countries. So in terms of all of that, we are working hard. Now, what is really needed for us to move with speed will be the necessary documentation. There must be the partnership agreements between these institutions and among ourselves, so that we know exactly who is doing what and how we are going to combine our investments and resources to do what we need to do. So I would say that in the nearest future, as we go back to our principles in terms of where we are in the conversation, there will be maybe another communication that will spell out in detail the timelines. But right now, I cannot say, I cannot give specific dates, but just to know that actions have started, which is important for us. We have already had the inaugural meeting for the operational, and in fact, we met with the Director General of WHO in Geneva just to debrief him very quickly, and so he expressed his sincere gratitude that we have started working on this very early on after the signing. So we are going to have a few more meetings, which will be hosted at the European Investment Bank and also at the Islamic Development Bank and also at the African Development Bank to really fine-tune the details. And we will carry everybody along as the details are being finalized. Thank you very much.
Thank you, Babatunde. Pablo, there's a question for you about the Inter-American Development Bank. How this conversation about the platform connects with the Alliance for Primary Healthcare? Is there any relationship there? Can you talk a bit about that?
Thank you, Javier. Yes, I think the momentum is really in our favor in the global conversations on health. I think first, like the realization that pandemic preparedness and resilience to climate change goes through having a very strong primary care. is being established. So that really allows us to be in other conversations and stress the importance of this topic. And for example, we're working with the Pan American Health Organization, with the World Bank, in developing the Alliance for Primary Healthcare in the Americas. We will have a meeting in early December in Montevideo. Uruguay, as you know, has a very strong primary healthcare system, so we will be able to learn about that. But it will have, of course, a very broad regional perspective, and talking about issues, for example, digital health, how interconnected care is now a possibility, a reality, and I think it's an important innovation that we need to move forward, using more digital health to strengthen primary care. So I'm very excited that we are having these conversations. I'm very excited also for what Babatunde just mentioned about how the platform is developing, with the very important lead of the regional entities, the regional development banks. And I think this momentum will continue to build. But what's also very important, and something that we like to stress, is we need to talk about the details, right? The devil is in the details, in terms not only of how we're going to finance, but how we're going to implement. What are the implementation models? For example, in primary care, is the best platform to develop the chronic care model to deal exactly with NCDs, or it's a very important model to work and to deliver mental health system services. So I really want to bring this also down to say, okay, we have these broad agreements, we're mobilizing resources, we need to really get into the details of how we're going to implement these things, and that's the type of discussions that we're going to have in Montevideo, and that we will be very happy to share with our partners and other institutions that are involved in the platform. Thank you.
Wonderful. Thank you, Pablo. Our time is running out, but I'll give you all, 30 seconds, final remarks, key, points for our audience to take away. So, Marianne, do you want us to get started on that one?
Sure. I'd love to share that adage of, if you build it, they will come. That may not be the case. I think we've all seen primary healthcare centers and facilities that have remained empty. And so we need to actually make sure that we're including the people that these centers are meant to serve, as we are thinking about designing and deploying the resources and the investments, so that we are 100% sure that they're actually responding to the needs that they have now, as well as the needs that they will have in the future. I think we saw during COVID the thirst, for information about how to stay healthy. I do think that continues. And so it will be important to make sure that we are integrating what the needs of the communities are as we design and build forward.
Great. Inclusion, participation going forward. Cornel, what are your key concluding remarks?
Thank you, Javier. I commend WHO and other international development banks to put together and to put in place this innovative way of financing. And I call other colleagues from various ministries of health so that they can have clear plans, because these opportunities, banks will come to our ministries and request what are our priorities. What are priorities must be in our plans and our reforms, so that we can make some catch-ups, so that next 7 years we may achieve what is set in universal health coverage. And thank you very much for inviting ministry for this conversation. It opens up the roadmaps and plans, and also the network. Thank you, over.
Thank you, Cornel. Pablo, what are your final remarks?
No, thank you very much, Javier. I think this is a great example of how multilateral development banks, we're being part of a transformation, evolution, it's been called. I think it's important to join efforts with the UN agencies in really trying to bring together the financial realm with the technical realm. And at the end of the day, we are owned by the countries. We respond to the demand by the countries. So we need to be certain that countries have the information and have some aspects that can incentivize them to work and to keep health in the center of the agenda. So I think this is a great opportunity to do that, and I appreciate the invitation for this conversation that certainly contributes to that purpose. Thank you.
Thank you, Pablo. Babatunde, you have the final word.
Thank you very much, Javier. And, for us, we're delighted to join this platform. I'm from the African Development Bank, and I want to thank all the other panelists. I want to leave the audience with three things to say that in terms of the potential platform value add, there are three things for us. One is that this platform is going to be a collaborative one in terms of integrated development of investment opportunities across different partners and different institutions. Two is that the platform is going to help us to focus more on delivering health outcomes for countries in terms of holistic models of health investments that will be needed in low and lower middle income countries. And third, to say that our focus through this platform is that we want to really ensure that we measure impact in terms of health benefit and not just financial flows to countries by ensuring, of course, that we integrate data into the platform to generate the kind of health benefits for our different countries that are really needed, and that finally, this is going to help us in terms of creating that kind of risk sharing and pooling between the partners that have joined hands for this platform. And so we look forward to engaging with more partners, particularly the private sector, to be able to support our countries, our member countries. Thank you very much.
Well, thank you very much, Babatunde. Thank you, Cornel, Pablo, Marianne. Thanks to our audience. I go with, a lot of hope. I see there's a window. I see there's political leadership. There's commitment. But of course, we will be looking and trying to see whether this is going to be different from previous initiatives that have not worked. So let's seize this opportunity and let's come back to it and let's discuss more about the how and all the other elements that we discussed today. Thank you all very much and have a good day.
Thank you.
Thank you.